we are going to look at the forms of memory. So first what we need to know is that the forms of memory. Before that, we'll ask some questions. So the first question is, what is a classification? What is a classification of memory? So how is it classified? The second question will be, in case of somatic, that is in case of factual informations, what part of the brain is associated with this? The third question will be, in case of the procedural. So in case of procedural, that is nothing but it includes skills as well as the habits. So in this case, what part of the brain is involved? So we will find out the answers to all these questions, and in the end of the video there are some bonus questions as well. So to start with, the forms of memory. So the forms of memory, there are two classifications. It is divided into two. First is the declarative. It is a declarative, or it is known as the explicit memory. So there's declarative as well as the explicit memory. Then we have the episodic. So episodic is nothing but the events. So this episodic events comes under the declarative memory, and there is also the somatic, that is the factual. So the forms of memory, the first is the declarative or the explicit memory. Under this comes the episodic and the somatic. Then we have something known as a non-declarative or the implicit memory. So this will be the second classification type. So under this there are again few more. We will discuss it later in this video. So first we are just going to look at the episodic and the somatic. So here, what is this episodic related to? The episodic, it is basically the events. So the part of the brain which is involved here is nothing but there is a hippocampus. Then there is also the medial temporal lobe and also the neocortex. So the episodic and the events, they are present in the hippocampus, medial temporal lobe and the neocortex. Now we will look at the somatic. The somatic or the factual information. So this is present in the prefrontal cortex. It is present in the prefrontal cortex and also the temporal lobe. Temporal lobe, that is the temporal cortex, that is the lateral and the anterior. Now we will go to the other category which we earlier discussed. So it is nothing but the non-declarative. So the non-declarative is divided into, there is something known as a procedural. There is a procedural that involves the skills and the habits. So this procedural skills, it includes the part of the brain is the striatum. It is a striatum, as well as the cerebellum is involved, and the motor cortex is also involved here. Then we move on to the priming. Priming as well as the perceptual. So in such case of thinking, that is a memory, what is involved is the neocortex. Then we look at the associative learning. So associative learning, so this is nothing but the classical conditions. This is the classical conditions. So this involves the amygdala as well as the cerebellum. So it involves the amygdala as well as the cerebellum. So now looking at the last subtype of this non-declarative or the implicit memory is the non-associative. So what is this non-associative learning? So this includes the habituation as well as the sensitization. So the brain involved here, the part is the reflex pathways are involved here. So now we are going to answer our questions. So the first question we asked was, in case of the somatic or the fracture, what is the part of the brain which is involved? Firstly, we need to know that somatic, it comes under nothing but it is the declarative or the explicit memory. So this will be the first thing which needs to strike. And where is the somatic factual? What does it relate to? It relates to the prefrontal cortex. Next, there is also the temporal cortex. So this is nothing but there is lateral as well as the anterior. The next question we asked was this was actually the second question we asked. So the very first question we asked was, what is the classification? So classification, as we know, there was the declarative. So let me erase and explain it. So first was the classification, that is there is declarative. So declarative is nothing but the explicit memory. So under declarative explicit memory, it includes the somatic. That is nothing but the factual. So there is also the episodic. So episodic, it involves the events. Next, what we need to know is there is a non-declarative. So non-declarative implicit memory. So under non-declarative implicit memory, it includes there is a procedural skills. Procedure, it includes the skills as well as the habits. Next, it also includes the priming and perceptual. It includes priming as well as the perceptual. And next, it includes the associative learning. That is nothing but the classical conditions. Next, it also includes the non-associative. The non-associative learning. So the non-associative learning, it includes the habituation as well as the sensitization. So this was the classification. So this was the first question. The second question we already saw. The somatization, it involves the prefrontal cortex, temporal cortex. So the third question we asked was, what is the procedural skills? What is the procedural skills? That is the skills as well as the habits. What part of the brain does it involve? So the involvement is of the striatum and the cerebellum or the motor cortex. Now we'll move on to our bonus questions. So here you can answer these in the comments. So the first question we want to ask is the episodic. The episodic is also nothing but the events. So here, what classification does this fall under? This will be the first part of the question. The second part of the question is, what are the parts of brain it involves? The second question we want to ask is, what is the classification? Classification of the non-declarative memory. So what are the types? The third question we want to ask is, in case of associated learning. So in associated learning, what are the parts of brain which is involved? So you can answer these questions in the comments.